Welcome! It's Ashley from Demystifying Your Health. Thank you for joining me today. I am so glad that you're here. In this episode, we're going to be talking about congestive heart failure. Lately, you've been feeling short of breath, and you've noticed that your lower legs and ankles have been swelling. So you go to the doctor, and she tells you that you have congestive heart failure. Well, you've heard of this before, you don't know exactly what that means. And how is it going to impact your life going forward? Let's find out. Congestive heart failure is also known as CHF, and it occurs when your heart doesn't pump as well as it should normally. And this is usually the result of your heart being either too weak or too stiff. And this comes from typically coronary artery disease, which is obviously when you have plaque buildup within your arteries. This is also known as CAD, or long-term high blood pressure. It also can be the result of, though, diabetes, obesity, sleep apnea, previous heart attacks, irregular heart rhythms, congenital heart problems, valve problems within your heart itself, certain medications, and even alcohol or tobacco use. So as you can see, a lot of things can result in CHF, but the most common causes are these two right here. And the inability to move blood out of your heart causes the blood to back up within your body. Typically, you're going to see this in your lungs, your lower extremities, such as your legs, your liver, and your abdomen. This is where you start having some of those symptoms. And it's classified on a 1 to 4 scale. When it comes to CHF symptoms, they're numerous. The most likely one, though, that you're going to experience is shortness of breath. And it's going to appear either when you're laying completely flat or when you're exerting yourself during some sort of physical activity. You're also going to experience fatigue, weakness, swelling in your legs, ankles, and feet, a rapid or irregular heartbeat, a persistent cough, wheezing, pink or white-colored phlegm, increased need to urinate, swelling of your abdomen, sudden weight gain, nausea, a lack of appetite, difficulty concentrating, and decreased alertness, and in some cases even chest pain. All of these are the result of that fluid being backed up into your body. So you're not getting enough blood flow out to where it needs to. This is where you're going to see that decreased alertness and difficulty concentrating. The other symptoms is that fluid being shifted to other parts of your body, like the weight gain, the increased need to urinate, the swelling of your ankles, the shortness of breath is when the fluid is in your lungs. So as you can see, it has a widespread impact. Obviously, if you're experiencing any of these, that's when you should be going to the doctor. Because complications, if CHF is not treated, and it gets to the point where it's incredibly severe, you can have kidney damage and failure, you can have heart valve issues, arrhythmias, which is irregular heart rhythms, and liver damage. So let's move on to the treatment section to see how this is treated. When it comes to treating CHF, the most important thing that you're going to be focusing on is medications. And there's 3 groups within this broad category that your doctor is going to be looking at. The first is you want to be able to control your blood pressure. And there's many different types of blood pressure medicine, such as beta blockers, ACE inhibitors, or ARBs. Your doctor is going to help you decide which one's best because they all work a little bit differently on your heart muscle. The next big thing is you're going to want to remove that excess fluid. It's going to make it easier and make your symptoms lessen. So typically you're going to be looking at diuretics or aldosterone antagonists. And then the third thing is you want to increase the strength of your heart contractions. And this is usually done through a medicine called digoxin. Usually you're going to need to be on some combination of all 3 types in order for you to have the best results. It takes a little bit of trial and error, and this is where it's very important to let your doctor know if things are working or not, so that way they can adjust things accordingly. If you get to the point where your CHF is severe, typically this involves having to have some form of procedure done. And there's several options here depending on what is going on, with your heart itself. So you're going to have things such as coronary bypass, which is obviously where they put ways of either synthetic or transplanting your own blood vessels to bypass the arteries that are either weakened or stiff. And you can have heart valve repair or replacement if you're having heart valve issues. You can have an implantable cardioverter defibrillator, or ICD, and this is if your heart for some reason goes into some form of arrhythmia that could be lethal. This helps to shock it out of that, or it also helps to get your heart back into normal rhythm by sending a steady current electrical impulse into your heart, so that way it follows that to actually contract when it's supposed to. Another option is cardio resynchronization therapy, or CRT, and the point of this is obviously to get your heart back into a normal rhythm. And if you have very severe CHF, then you might need a heart transplant to actually replace your heart because it is no longer functioning to basically be able to sustain life. So that's why that is for the most severe cases. As you can see, there's a lot of options to treat CHF. Your doctor's going to help you decide what is best for you given your certain medical history, the current classification of where your CHF is at. Typically, we're starting with medications. Hopefully, this will keep it controlled, and then that way you're going to be able to avoid the procedures if at all possible. When it comes to preventing CHF, you want to take a long-term approach. The things that cause it to occur don't happen overnight. When you think of coronary artery disease or high blood pressure, they take years to develop. So this means you need to do stuff every day to help prevent developing those so you don't end up with CHF. Big thing here is you want to maintain a healthy weight. And there are several ways to do this. The first is to eat healthy. So limit salt, fats, and alcohol in your diet. While you want to get plenty of whole grains, lean protein, fruits, and vegetables. Then you also don't want to smoke, or if you do smoke, you want to quit. If you need help with that, reach out to your doctor. They can provide ways to do this. And you want to be as active as possible. Try to get the recommended daily amounts of activity every day. And then reduce stress, because obviously stress is not good for your body overall. And get adequate amounts of good quality sleep every night. This is important. This is when your body repairs itself. And if you do have CHF and you want to make sure you're preventing complications, here you want to restrict fluid intake. If you don't have CHF yet, you want to drink plenty of water throughout the day. Your body needs to be hydrated in order to function well. So by following all these things, you're going to greatly decrease your chances of developing congestive heart failure. No one wants congestive heart failure, so do all that you possibly can to prevent getting it. If you already have it, take comfort in knowing there are measures that you can follow to help manage it to the best of your ability. Thank you for joining me today. I appreciate you spending some time with me. If you found what you heard today valuable, please like, share, subscribe. If you have questions, comments, send me a message, put them below. I'd love to hear from you. And until next time, stay healthy.